Welcome to the NP-POW videocast, a space where we will talk to nurse practitioner experts who will share their POWs, or pearls of wisdom, on an array of healthcare topics. I'm your host, Dr. Julia Rogers, a certified nurse practitioner. And today we are honored to have Dr. Stephen Ferrara with us to discuss artificial intelligence, better known as AI and practice. Dr. Ferrara, it is an honor to have you joining us today for the NP-POW.
Thank you so much for having me. It's a privilege to be here.
First, can you just tell me a little about yourself, your passions, and what really inspired you to become a nurse practitioner leader, currently the AANP president and the Associate Dean of Artificial Intelligence within the School of Nursing at Columbia University?
Yeah, so I am a family nurse practitioner by background, and I've been in NP for 25 years. It hurts to say that at times because it feels like a long time, but I've been in NP for 25 years, a family nurse practitioner, and I've been mostly in primary care settings throughout my clinical career. And it's been great. I love primary care. I love being able to devise plans with my patients, but I've always had this policy desire. And it sort of happened early on when I realized that nurse practitioners can't do the same things in every state. And that was confusing to me. I am in New York. And at the time when I first became a nurse practitioner, we did not have full practice authority. And I just became very impassioned to try and fix that. So I became very involved with my state NP organization. I'm happy to say that New York is now one of the 27 states that does have full practice authority for nurse practitioners. And from there, I became involved with our national association, AANP, been on that board as a region director and now as president of AANP, which is such an honor and a privilege to be able to represent the NP profession. And it's been great. You know, I'm in the final months of my tenure as president of AANP. It's a 2-year term, and it's been a gratifying experience. So that's been my sort of professional outlook. And how I got involved in AI is I've always been involved with technology, but never formally putting the two together. And I speak to a lot of nurses and other healthcare people in this new role that I have as Associate Dean of AI. And the difference is I don't have a formal background in informatics. And I talk to a lot of people who are in informatics, but my background is in health policy. And I think policy is such needed when we're talking about AI and all of this new sort of unknown, because we do need policies. We do need smart rules and regulations to sort of protect our patients, to protect ourselves. And I know we're going to get into a little bit of that. So I approach it as something of a policy challenge. And I credit my dean here at Columbia University School of Nursing, who sort of said, you know, AI is a priority for the School of Nursing. I've been at Columbia for some time in a different role, and now here I am in this Associate Dean of AI role. So it's been great. This is as of, the last 7-8 months I've been in this role. So it's been really exciting.
Yeah, I can't wait to see what becomes of all of that as it continuously progresses.
Yes,
I'm wondering if you could share the potential benefits of actually integrating AI into NP practices, particularly in terms of workflow efficiency and also patient outcomes.
Yeah, I think where we are in AI today in the clinical space, we're looking to tackle the administrative burdens that plague primary care clinicians, nurse practitioners, particularly. We know the old adage, if you didn't document it, you didn't do it. And it just seems that most of our time is spent documenting things that already happened. And right now in the clinical space, we're seeing the advent of AI scribes, if you will. So these are the ambient listening capabilities of AI, where with patient consent, it is recording the visit, transcribing the visit, and actually putting it into a format that the user prefers. So a SOAP note type format, or whatever institution sets forth their guidelines, and it's putting that into actionable, readable note that is not finalized. It's not perfect. And it's not like the NP can sort of say, okay, this is a perfect note and move on to the next one. We still have to read it. We still have to make corrections. But that is where we are today from a scribe perspective. And I really think it's going to combat the administrative burden, the fact that we finish our clinical day in the office and then we go home and we finish documentation after dinner, after our home responsibilities. And that should not be the way that we practice. That's where we are today with AI scribes. And I think if that's all we get out of AI, that puts us forward. But there's so much more potential. And that's also the exciting part.
I also think that gives us a lot more time with our patients. Like we're physically looking at them. We're able to interact with them on such a better level than staring behind a screen.
Absolutely. And that's what nurse practitioners are known for, right? Connecting with our patients, hearing their stories. And I am not a fan of the documentation, and there's all different EMRs out there. And we know that the adoption of EMRs was messy. And, we're still sort of paying for that because they're not the most user friendly. It's still a lot of clicks. It's still a lot of navigating around. So now if we could get out from behind the computer screen and I'm able to speak to my patient and listen to them, I think that's just going to have a much better connection and we can do the great work that we all are ready to do.
Absolutely. What do you think are the most promising applications of AI in advanced practice nursing? And how do you believe that they will be able to enhance our delivery of patient care?
What we're seeing is we have access to more and more patient data than we've ever had before. And it's centralized in an electronic health record in a chart, but it's impossible for any one person to read through every encounter note, every progress note that's been done to date. So where AI can come in with the technology, we're able to say, summarize this patient with their chronic illnesses they have, summarize that for me. And not only can it do it in seconds, but we have the ability to ask questions to the AI agent to be able to sort of make our best recommendations for when we're trying to use the knowledge that we have to apply it to that patient. Information isn't any good if we can't access it or if we can't synthesize it. So that's where AI can really, really shine. And again, I'm talking a little bit about where we're moving and not necessarily what exists today, but we're really, really close. And the field is moving, as I'm sure you've seen in the headlines, very, very rapidly. So things are changing ever so literally by the day.
I'm always interested to see where AI will lead us, like with genomics, because when you start putting those two together, I think that we'll have much better patient care and be able to have the time to do that.
It's why we want to take care of other human beings so we can provide the best possible care. And if we have data that is relevant that we can integrate into a treatment plan, well, we should absolutely be doing that.
How do you see AI impacting our decision-making process within nursing, our nursing role? And then how do you believe that we as nurse practitioners can play a role within that context?
Yeah, I think that AI will allow us to take the information, the knowledge that we have, and apply it again to that particular patient for that particular encounter. And that's where the potential of AI can really, really shine. What's critical about all of this is that nurse practitioners and nurses are at the table when we are sort of talking about AI solutions, and that it's being informed by frontline clinicians and not by people who aren't familiar with workflows and how a nurse practitioner conducts a visit. It's critical. And I think that's an opportunity for nursing and for nurse practitioners to become involved. You don't need to be an expert in AI per se, but you need to be an expert in the work that you do. And I'm going to assume that people are. They know their workflows. They know what needs to get done. That's where we need to really hook up those clinicians with the AI developers, with the informaticists, so that we can truly work together so we are as efficient as we possibly can be. And again, we're hoping to get those improved patient outcomes as a result of it.
Something else nurse practitioners are very good at is collaborating with others and kind of being at the table.
Absolutely.
In your opinion, what are the most significant pitfalls of relying on AI in clinical decision making? And then tell us about how we can mitigate these.
So bias comes to mind as one of our first challenges, is that we know that a lot of the information that we have was a result of biased data, right? Or biased information, when traditionally clinical trials have only been done on a subset of the population. And if AI models were trained on that data, it's going to perpetuate that problem of assuming one particular type of patient subset. But the good news is we know about that. And we don't want to repeat sort of some of those same mistakes of the past. And as a result, we can get ahead of the bias issue and recognize it and know that the information we are receiving from the computer, if you will, there's the potential for bias and we can correct for that. So that's number one, is the bias. The other things we need to be mindful of is the environment. AI takes up a lot of energy and a lot of electricity, and that's a concern. It should be a concern because we don't always think about the power that it takes to bring a product to your computer screen. But the reality is, in the background, it's a very labor-intensive process that's happening on the back end. So the environment has to be a concern as well. And I think lastly is always ensuring that a human is in the loop. And that's the term we like to use. This is not autonomous driving where you sit back and the car is driving itself. We always need to ensure that a human being, one that holds a license to practice their profession, is the one making the final decision on anything that's happening with a patient. Now, for some messages, maybe, there could be some automation, but when it comes down to making a clinical decision or prescribing something, we need to make sure that the human being with that license is making that final decision.
Yes, I'm glad to see the stance that you've been coming out with, saying, don't use this term to, say AI is the nurse or the provider, because it is not.
It is not. AI agents do not, go to nursing school. They don't pass the NCLEX exam. They don't, at least not today, right? And I will say that AI is not taking the job of the nurse or the job of the nurse practitioner. But I think we have to be very mindful of the language that we use. And we don't want to call an AI product nurse practitioner so-and-so or nurse so-and-so. We need to be very mindful of, the AI is a tool. Just like a stethoscope is a tool that we use to assess our patients. We need to be the ones at the end of the day making those final decisions.
Absolutely. How do you think AI can be used to address things like health disparities and improve access to care for our underserved populations?
I think it's going to allow us to utilize all the resources that are available that aren't always accessible to us. So I think about things like clinical trials. There's more of a concerted effort to make sure that we're studying diverse populations because we know that people respond differently to different medications. So how can we capture and harness some of that information that AI allows us to do and apply it to our patients? It's essentially getting to a more precise, more personalized approach to patient care. And I think, again, that's why we want to do this. We know that there's not a one fit solution that fits every scenario. So I think that's where we see AI being able to so that we can leverage that. And we have to be mindful of AI, that it can widen the disparities. Think of a under-resourced healthcare system that may not have the ability to have the latest AI tool. We need to overcome these challenges, and we don't want to create two tiers of healthcare, those that have the resources and those that do not. And I believe the way to combat that is by having these frank conversations, by acknowledging that differences do exist, and how can policymakers cross that divide? And how can we level the playing field for everyone? So it has to happen, and we can't do this in a vacuum. We have to recognize that different healthcare systems have access to different resources because of payment models. And that's where I think we have to talk about it and acknowledge it and come up with solutions for it.
Absolutely. As we all know, there is a significant shortage in our mental health care services. So can you provide some insights on how AI might support some mental health care in practice, or have you seen something that is already in place?
Well, anecdotally, I'm seeing friends and colleagues that are using AI, and I'm not going to endorse one AI product over another. There's many out there, and I would say that listeners should try all of them, because some work better at things than others do. But we're seeing that AI is becoming an outlet for people to talk to and can share some insights with our patients as a result of using the AI agent. So I think, again, we have to be mindful that we're not letting AI make diagnoses on its own, but a lot of the mental health issues that we see are behavioral in nature, and we don't always have access to clinicians. We know that that's a significant problem. Mental health access, mental health reimbursement for clinicians, it's a tough environment. So if we can find a way to have patients use AI, and I think that's the other frontier that we should be having these conversations. How can we empower our patients to use AI, and be very transparent about, this is something that I want you to use in conjunction with regular interventions with a licensed clinician. But how can we use it? How can our patients use it to motivate, to support, and really get to the established goals that the patient and the clinician want to attain? So I think AI can definitely fill in some of those gaps where we just don't have enough mental health care professionals, and we could use it together as a resource.
It's always interesting how many patients or even nurses say, well, I don't use AI. But then when you start talking to them about their step tracker or other things that they may utilize on a day-to-day basis and say, this is part of AI, the light bulb kind of goes off like, oh, I am already using it.
That's right. And what has been the case for the most part so far is that your tracker, your watch device, that sort of lives outside of the electronic health record, right? That's all information that could be relevant. And we just haven't had the opportunity to integrate that into a centralized repository. What AI can do is, AI is not the centralized repository, but AI can extract the trends and put like these steps and your heart rate along with your medical record. And we're able to, again, have the ability to have insights into scenarios that we didn't have before. Because, yes, Holter monitors have existed, right? But they're big and they're clunky. And patients who had to have, cardiac monitoring, it used to be a problem and a challenge to do. Now, these devices are part of us. They're wearable, they're accessible, they're relatively inexpensive. And the question is, what do we do with that data now that we have all of it? AI can help us discern that.
And sometimes it helps remind patients to let us know some information. So sometimes
Exactly.
when I look at that, I find things that they just didn't even mention.
Absolutely. Our health visits are condensed for time. That's a challenge. And, how can we maximize that limited time that patients spend with clinicians to be the most effective that they possibly could be?
Yes. What types of AI algorithms or models do you believe are most relevant for APRNs, and why do you think that these are significant?
Yeah, I think what we're going to see for nurse practitioners are the clinical decision support tools that have existed for some time. Clinical decision support is not necessarily new, but the way that they were modeled were based on, an algorithm per se. What AI can do, and that this is where, the excitement is that it has the capability of learning and being able to make different recommendations based on different scenarios. Whereas in the past, the clinical decision support was pretty rigid as far as the process. So AI has the potential to do that. And I think, again, this is not to take the place, again, and I want to be very clear, this is not to take the place of what a clinician can do. This is not a shortcut into being an advanced practice registered nurse, but it is a tool, and it's the tool that the clinician can correctly use and administer that is going to be the difference between a patient having better outcomes compared to the clinician who's not using it and that patient not having the best outcomes. So it becomes so critical, so important for us to use these clinical decision support tools to get to the best outcomes that we possibly can.
What kind of challenges do you think nurse practitioners face when implementing these AI technologies into practice? And then how do you suggest that those challenges be addressed?
I think the biggest challenge is the implementation part of any technology. Again, I hark back to the days of the EMR, the EHR, where, you went to this training and there were all these modules you had to do, and it's clunky. It's a great way to suck out the enthusiasm for something that is supposed to make life a little bit easier for folks. So I think we have to be very mindful of how these technologies are implemented into the clinical space. We know if too much is done at once, it's a good way to really sabotage the whole project. So it requires a thoughtful approach. It requires an evidence-based approach. I mean, implementation science is a science. So organizations and institutions have to make sure that they're allowing for the proper ramp-up time before anything is deployed. And, a lot of testing is being done, beforehand. And again, I'm going to go back to the fact that clinicians and nurse practitioners need to be involved in the idea of whatever clinical tool is being used, all the way to rollout, to launch. We need to be having thoughtful consideration, thoughtful input, because it's not very effective if we can't use it and it doesn't do what we think it will do.
I always say it's just time for us to step up and have seats, not just one seat, but seats at the table.
Absolutely.
And it's always changing. So we have to be prepared for this continuous change because it's so new. We know that it's going to change probably multiple iterations before we get it right.
It is. And that's challenging to a clinician because, our workflows are already complicated. And now you want me to learn something new. And in 6 months, it's not even 6 months anymore. It's less than 6 months is the cycle these days of new models coming out. It's just very, very rapid pace. So the good news is the models are getting better. And as they improve, there's less training that we will need to do up front. So that's a positive. But right now, we just can't burn people out because we're asking them to learn another new process or another new feature. So we have to, go into this knowing that it's going to continue to evolve. What we like to say about AI is that today is the worst it will ever be. It will only get better from here on out. And as a result of that getting better, it'll become more user-friendly for us as well.
I love that saying. I'm gonna steal it from you.
Yes, feel free, because I've stolen it from others, who've been working in this space for a lot longer than I have.
What ethical concerns do you think arise from the use of AI in healthcare, especially regarding our patient privacy and data security?
I think patient privacy and data security is issue number one. The question is, where is this information? Is it accessible after it's used? I mean, when we're talking about ambient scribes, they're actually recording the interaction, right? So there's a transcription of the interaction. So first up is patients need to consent to this. And, I think if we have to understand, us as clinicians, we have to understand what happens in this data transcription. Most, not all, but most of the AI scribe services do not retain the actual transcript, the actual audio recording beyond a certain amount of time. So it's automatically purged. And I think patients need to understand that, and they need to hear that. I think they also need to be assured that this is protected information held at the highest standards of data security. And there are a number of tools in place that will prevent the, hacking of that information. So we need to understand that as clinicians. Our patients need to understand that as it's their information. It's very private to them. And that is critical before anybody wants to talk about, using this as a tool. So it's critically important that we have those assurances from the software vendors, from our institutions, and it falls under, that protected health information. But we need to understand it. And each vendor has a little bit of a different process of what they do. But I can say no one is retaining this information forever, right? It doesn't live on their servers after the encounter is transcribed. It stays for a certain number of days, the recording, and then it's purged. And then it goes into your medical record just like any other entry into a medical record. So data privacy has to be paramount. We have to be assured that, this is taken very, very seriously.
I'm just wondering, as a side note, is there anywhere that there are exemplars of patient consents or, that nurse practitioners have availability to so that we can kind of pull them off and then tweak them to our own practices? Is there such a place for those things?
So I don't know of any repository per se, but I know that they're usually vendor specific. So if, again, and there's lots of different AI vendors out there that have the scribe technology. So they will have their own, and then the institution will adopt it customized. But I am certain that there are some samples and examples out there, but I would say that use the one specific to the software product you're using, and that will keep things, just in the right from a legal perspective.
And we can always have AI generate a starter.
We can always have AI assist us, that's for sure.
As an expert in this field, how do you think we can advocate for responsible use of AI within our own organizations and our own practices? Specifically, talk about what kind of training may we want to set up, or education should we be providing?
It's a huge challenge because when we think about generative AI, and this is, what's powering the scribes and all of this other advances, it's only been around since really November of 2023 that it became available to the public, right? So it's still new. Although AI has been around for decades in some form, but it hasn't been in the accessible version that we have access to today. So when it comes to policies, we are literally in uncharted territories. And I think that there needs to be a little bit of grace given, but that's not a license to sort of say, well, we're going to wait to devise a policy because we're not sure yet. So AI is here. We need to ensure that there is a policy on it, and know that that policy is going to be refined over time. And it should include the voices of clinicians, of nurses, nurse practitioners, physicians, on what that looks like for that particular institution or that particular practice. Responsible use is critically important. There are some guidelines out there in the literature that talk about responsible use of AI. And I love to think about the challenge ahead of us. there are 5 million nurses that are practicing right now, in the United States. That's training that 5 million is a big number. And then we think about like the pipeline and the schools of nursing that have to integrate this so that at least we can get the next generation up to speed before they enter the workforce. So it's a massive undertaking. We're not going to learn it overnight, but it is something that will be part of our workflows in the very near future, if it's not already.
How do you, because it's evolving so rapidly, how do you suggest that we can stay informed about, the evolution of AI? Is there a place where we can go? Is there a website about AI, or what is your suggestion?
Yeah, it's a little bit messy these days because there's a lot of noise. There's just a lot of buzz about AI. So I would always tell individuals to look to their professional associations because they are on top of it. I mean, the American Nurses Association does have AI statement. AANP, the American Association of Nurse Practitioners, does as well. And, the idea is, again, we're shaping this. We're doing this in real time. And then there are the specialty organizations and, there are the informatic associations that are out there. I would look to them for resources to help steer, again, beyond the noise, beyond somewhat of the chaos. And, again, I think, we live in an information age. Just because information is out there doesn't always mean it's good or it's actionable. So I would lean on our professional associations to help us navigate these unknowns.
Yeah, great advice. Looking ahead, how do you envision the future of nursing practice with the integration of AI technologies? And then also, what kind of skill set do you think is going to be essential for us nurse practitioners?
I think anyone in healthcare is going to have to be comfortable with change because things are rapidly changing. Whether it's a procedure or a new technology, it occurs quickly, right? So change, you have to get comfortable with change. And I don't like change. I know there's a lot of us out there that don't necessarily, like to do new things all the time, but there's an aspect that we have to get comfortable with it. So there's that aspect. So what would our future look like? I envision a day where we have the ability to not only have scribes listen to our interactions, but there's actually sensors and there's video that's recording. Again, I know this is where it gets a little bit unsettling because I don't want a video recording my patient interactions, but we will have the ability that we can measure wounds. We can actually take sort of the interaction of data that has been largely unstructured and put it into structured format and then follow that over time. And it'll use video, it'll use sensors. It will really take the burden of the documentation out of the equation. And, we're a better informed clinician with better data. And the question is, do we act on that data or not? And I think that's where the expertise of working with information comes in, because that's what we do at the end of the day. We're making decisions based on lab work. We're making decisions based on diagnostic imaging. Now we're going to have access to more of that. How do we put it in context with what a patient wants, a patient's goals, what our goals are together? And again, at the end of the day, being able to provide the best care that we can to our patients. I think I'm excited for the future. It won't all be rosy. There's still a lot of questions that remain, of course, but I think that the reason why I'm so excited is because we're going to be able to do our jobs better. And that's why I wake up every day.
I'm excited too. I do think that this is going to improve patient care, patient outcomes. And so let's get back together in 10 years to go through this and see if we were right.
It may not even take 10 years, maybe, 10 months at this point, but it is going fast. But I do I wonder what it will be like in 5, 10 years. And I think it's exciting.
In your last few minutes, can you please share one or two POWs or pearls of wisdom with our nurse practitioner listeners that you and they can use and you found just the most useful or beneficial in using AI in practice?
Yeah. So I think outside of the scribe work, our applications of AI is fairly limited. And I would be remiss to leave out, be mindful of putting protected health information into any AI system. There are universities and institutions that may have their own enterprise versions of AI that allow some information to be uploaded, but be very mindful about putting anything that's protected health information into AI. So outside of that, there's nothing preventing you from putting in the patient's story, 78-year-old male, and go through the whole past medical history and medications as long as it's not identifiable. And have AI, if there's a challenge, come up with a differential diagnosis, or if something is challenging. And the prompt that you put in, we have this fancy term, prompt engineering, and it sounds a little bit vague, but the way you write the input into an AI is really going to determine the output that you get. So if you can spend some time, and again, there's no instruction manual per se on AI. So I would encourage anyone that's contemplating using AI is to use it. Work with some prompting and use case scenarios. So you may know the outcome already, but have AI see if it could get to that point. So my pearl would be to put some effort into your prompt engineering. Be very specific on what you are looking to get. And we know that AI is overly accommodating at times and wants to please you if you've ever used AI extensively. And it's okay to push back on AI and say, I don't think that's right. And you will see responses saying, you know what? You're right. I've double checked. And what I told you before is not necessarily right. So, don't assume that everything is accurate from AI. Always verify. Never let AI take over as far as the final decision. And I think that is one of the pearls that I would say. Another pearl, again, I think it would just be that be ready, trying to prepare ourselves for, the different tools, the different abilities of what is capable for AI. And I think there are solutions that NPs are going to come up with that haven't been thought of yet. And as a result of that, we're going to be able to do better and just be better clinicians at the end of the day. So get a little bit comfortable with change, become familiar with how AI works. And everybody doesn't have to become an engineer, software engineer about AI, but just think about, the way we're going to use this. And workflows are going to change. We shouldn't think that just because our workflow is, the medical assistant calls in the patient and takes their vitals, and then we come into the office. Like, we need to be open to the idea of that whole workflow could change. And in many cases, it should change. So we shouldn't put AI into our old, antiquated workflows. We should allow ourselves to think outside the box, to reimagine the way that things have been done so that we can get to a better place of efficiency, less, I'm going to say, no burnout from administrative and documentation burden, that AI is working in the background to write that prior authorization letter so that we don't have to start from scratch every time an insurance company denies something that seems very obvious that a patient should have access to. And I think that's where we will ultimately be.
I just want to tag on to that a little bit, which is, I think that as professors and at universities, we also have to stop being scared of our students using it. And we should be incorporating that into our nurse practitioner courses, nursing courses, so that they are ready for it, and then they also know how to use it responsibly.
Absolutely. And that's one part of my aspect here at Columbia is educating the faculty, providing trainings and workshops for the faculty so that we're not approaching this saying, oh, students are going to use it and they're going to cheat. That is not the point of what we're trying to do. Right. And so, it's a resource, right? And AI is not very good at writing personalized, deep thought. So that means that we're going to have to reimagine the way that we assess students. So that's more work on faculty's part, but that's okay. We can do that. And how can we have AI integrated so that students are able to identify their areas of weakness on their own and have customized study plans so that they don't have to worry about, one particular area that they obviously have a good grasp on. How can they focus on some of the other areas? So one of the first things we did at Columbia is we have an explicit acknowledgement of AI in every syllabi. Now, that particular instructor or professor may say that my explicit is you cannot use AI for any assignment. But at the very least, we're acknowledging that AI exists. And maybe for one assignment, you could use AI in a thoughtful way. And we absolutely need to be doing that. And there are some good papers out there on integrating AI into curricula. And even papers that were written and published last year are somewhat dated. Right. But it's something that especially schools of nursing, but all health professions should be having these conversations. Because here's the other point that I try and think of. Yes, nursing is important. We're 5 million, as I stated, but we work with other healthcare professionals. So it shouldn't just be AI for nurses. It should be AI for healthcare. And how can we all collectively utilize this in a way that we all understand it? And again, where our patients are benefiting from it.
Absolutely. I have gained so much knowledge today, Dr. Ferrara. So I truly appreciate all that you have done to actually lead us as nurse practitioners into the future with AI. So thank you for sharing your time, your insights, and your powerful words of wisdom with us on the NP-POW podcast today.
Yeah, thank you again for having me. It's been a pleasure. And I look forward to an invite again to see where we've landed.
All right, you're on.
Okay, great. Sounds good.
I also want to thank all of our viewers and hope that you come back to hear more pearls of wisdom from our NP experts in the future. Until then, this is Julia Rogers wishing you joy today and every day.
For more great content from the Nurse Practitioner, be sure to visit us online at tnpj.com for the latest NCPD articles, columns, and much more. Please leave us a 5-star review on iTunes and Spotify, as it helps with the podcast's visibility and helps us to keep bringing you this great content. Also, don't forget to follow us on Facebook, Instagram, and LinkedIn at The Nurse Practitioner Journal, and on X at TNPJ_journal. Thanks for listening. This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed on this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Wolters Kluwer. Thanks again for listening.